Chief Operating Officer, Circulation. John Brownstein, co-founder, Circulation. Welcome to Juicing with Gary.
Thanks so much. Great to be here.
Welcome,
Gary.
Caitlin. Well,
Nice
this
to
is
meet
an
you.
honor for me. So today, I've chosen as our special vegetable, the beet. We're gonna turn the beet
Oh
around.
my God.
Yeah.
Can't you smell the passion?
Yes.
Turn it upside down. Can't you taste the action? Can't you feel it? Yeah.
Yeah.
So what I'd like you to do is, Caitlin, I'm gonna ask you to cut the vegetables and fruits
I'm ready.
as I talk about it, and then John,
Yeah.
I'm gonna ask you to actually operate the machine.
Done.
You have an operator's license?
Sure.
Okay, good enough for me. All right, Caitlin, let's get these oranges.
Okay.
Be very careful, very sharp. Wonderful. What do you notice about the
Blood
orange?
orange. I like the theme.
A blood orange, the heartbeat. That's very good, exactly.
great.
All right, now here's the beautiful
The beet.
beet. And by the way, in ancient days, they never ate the beet because they're called beetroots. They only ate the greens.
Really?
Yep, Napoleon Bonaparte was the one who actually determined that we should eat more beets because they were out of sugar in France during that time. Yeah, see, amazing how much I know, right? I'm not just a good-looking actor, right? So, okay, we got that. All right, let's do it. Let's do it. Right down and in. Whoa, huh? Yeah, this is serious stuff. This is no kidding.
All right, let's do it.
All right, get the beet. This is gonna be so good for our hearts. And by the way, you know what the
Looks
recent...
pretty, too.
Isn't it beautiful? Yeah, see how the colors change in that?
Yeah, this
Isn't
is
it
serious
amazing?
separation.
Yep.
What I'd like you to do, don't pour it yet, John.
Okay.
Just take that and the official stir, and I'd like you
Okay.
to just stir the juice up.
Okay.
And then, John, I'm
The
gonna ask you to
official
do
stir.
us the honor,
Oh, great.
right? And you can pour us each a beautiful glass of that,
Fantastic.
equally out best we can. Yeah, perfect. Yeah, you'd make a great waiter. Yeah, you
This is
just,
good. This is nice.
really good.
Should
This- yeah.
Chuck it over the.
You would
Just
rather
so-
just drink. Oh, that's awesome! Awesome!
It's down my shoe.
That
Say
was
about
the
that.
first. That's a first for us.
Okay, you know what?
Here you go. I'll pour the juice. Yeah, you know, that was not a trick.
It's just our conference room, so it's fine. Nobody's gonna have a problem with it. Okay.
Well, you're gonna smell great all day.
All right.
In
Good.
all-
I just have the juice down my shoe, but it's all good.
I'm glad I'm wearing rain boots.
Yeah. Exactly. It's true. So,
In all seriousness, this is great. Thanks so much. We're real excited to hear about the story. That's the important part of this. And I hope you did enjoy the juice.
it's me. Yeah.
Very
Well,
much
looking
so.
forward to it.
Well,
Cheers.
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 Thank you.
Cheers.
Trace it. Well, Caitlin, John, thanks for being here today, and thanks for juicing with me. Did you enjoy it?
Loved it.
Very much so.
Well, with that said, what I'd like to do before we start to talk about circulation, about the great work that you and your colleagues are doing, and I'm really excited. I'm actually juiced about doing that. I am. This is an important story. But also important to it is, who are you? Each one of you, what is your story? Where are you from? And Caitlin, you just share a little bit about your story?
Sure. I grew up in the Boston area. Always thought I'd leave Boston for a short period of time before coming back, but ended up going to school in Boston, finding my first job out of Boston, and just like I think most college kids, I had no idea what I wanted to do. So took a job where I could learn as much as humanly possible in as little time as possible. Was lucky enough to get a job at Bain Capital Investing, and you learn a lot about what works for businesses and what doesn't work for businesses, and more importantly, what kind of business you want to be in. From there, I quickly realized that I'd much rather be in a business innovating and operating as opposed to taking guesses and investing in other people's ideas. So went to another private equity firm to do operational consulting for them and learn more about how to make an impact in a real business with real people before I realized I really liked healthcare. I know that seems like a funny transition about how do you go from investing to really liking healthcare, but to me that's where you have not only the most complicated problems to solve, but also the most impactful. I think everyone has a story of they had a sick parent or a sick friend or grandparent, and knowing that you can make a difference in the way care is delivered not only to the patient themselves, but to the caregiver, which is sometimes equally as important, is what really drove me to make that change.
John, tell us about yourself.
Yeah, so I'm Canadian and grew up in Montreal, and always was sort of down this path of healthcare, really maybe the more standard path of going down to do an MD, really driving to that. I took actually a year and spent it in Kenya and Uganda, and recognized the sort of real burden of disease at a population level, and really understanding the impact of infectious disease like malaria and gastrointestinal infection. And then recognized there's opportunities that are sort of beyond just the traditional MD path, and really went down this idea of public health, the idea of impacting lives at a massive scale rather than at the one-to-one level. So I found this whole field of epidemiology, which can combine statistics and social sciences and geography, and combine all these sort of areas of interest into sort of one field. I ended up going to do a PhD where I really focused on field work, because I thought I was going to do work in infectious disease based on my experience. Actually was collecting ticks in Connecticut and across the Northeast for my PhD work. I got Lyme disease. Wow. So not dissimilar from my juicing experience, but my tick collecting experience wasn't so great either. Got Lyme disease and then realized, okay, you know what? Maybe I don't need to be out in the field collecting data. So then I thought, okay, why not think about data sets that I can harness to think about data analysis and get new insights at real major scale about populations. And so actually ended up spending a whole time founding this field of digital epidemiology, taking massive data from all sorts of like EMRs, but also social media data, and built a whole career on that. And actually I came to Harvard as a professor and at Boston Children's Hospital, where I started working on this idea of integrating data and really trying to take new fields of technology and bringing them into healthcare. And that's really where we started to think about, well, what are the other areas where we can impact the sort of patient journey? And that's where transportation began.
So let's talk a little bit about circulation. So how did this start to come together? Now that I know you have a background in public health, I sense it, and hearing from you sort of your appreciation for making an impact on people. So tell us the story. Where did it come from? Who are the founders, and how did it happen?
So we founded the company a few years ago. This was with Robin Heffernan and Jared Hawkins, who's the CTO, and Robin is the CEO. The initial idea really comes from this concept of looking at what consumers are experiencing in their daily lives and wondering why patients aren't seeing that same level of access. You know, over the last 5 years, we've seen the rise of Uber and Lyft, and the way that we move around cities and areas really has completely been transformed. And then when you look at what patients experience, it's completely different, right? They have taxi vouchers, they're waiting for their transportation for hours. It's really a lack of clarity and lack of transparency, and it's a real burden on the healthcare system. Something that we actually haven't really thought about, transportation as being part of the healthcare infrastructure. So we had this initial idea, and the first way that we thought about it was like, well, why not take the entire Uber network and think about it as a healthcare delivery network? And so we wrote this email actually to Uber. Actually, it was a response to a support ticket that where people would complain about the ride. But instead of complaining about the ride, we wrote, the ride was fine, but why not think about healthcare instead? And someone on the other end somehow knew something about healthcare and was like, okay, that's a weird response from a Uber ride. So they came to our office and at Boston Children's, and we thought about, okay, we pitched them the simplest idea. What if on one day we put nurses in Uber cars and delivered vaccines and did that on demand and put a new button on the Uber app that said Uber Health, and you could get a vaccine to your door and do something as simple as getting a flu shot, not controversial, something that people do yearly. But we see massive lack of uptake of the vaccine each year, not because people necessarily are against it, it's just it's not convenient, they just don't do it. So we did that, we ran it for 3 years, 40 cities, and we saw major upswing in influenza immunizations just based on the fact that it was convenient. And that was sort of an aha moment, on-demand healthcare. And yes, everybody was talking about how do I create the Uber for healthcare and all sorts of domains. We actually created the actual Uber for healthcare because it was Uber in healthcare. And so that led us to realizing, okay, well, there's a much bigger opportunity at play here. Because if you can start to insert on-demand into the healthcare journey for a patient, you can all of a sudden change a lot of things. You can get patients to their appointment on time, you can get them discharged in a timely manner, you can improve patient satisfaction, you can reduce, of course, the impact downstream because of the patients have come to their appointments, you can ultimately reduce costs. So huge amounts of opportunities come from just this one insertion of a technology that wasn't even meant to be a healthcare tool.
So at Circulation, talk about the model, talk about the framework of what it is that you do.
Yeah, so the framework of what we do is our goal is to be a logistics platform for all of healthcare. So if you think about where healthcare is moving to a more value-based, keeping patients in their home in lower cost of care settings, inevitably you need more logistics to make that happen. You need to move patients from their home to their follow-up appointments. You need to move things to patients, whether it's DME, prescriptions, nurses into the home. And circulation is intended to be the single platform that allows for the management and tracking of all of that. As we talked about earlier, all healthcare is local, so if you don't have a platform to do that, it becomes almost impossible to manage. What we offer is a software that automatically gatekeeps around what's happening, matches patients to their exact needs in the right location, and then offers ancillary services so that we can help intervene if something goes wrong.
So how do we get this into the communities? And I'd like to at some point talk about where you are actually delivering the service, because I have to assume it sounds so simple, but at the same time, I have to, I guess, sign up or something. So are you delivering it through health plans, or how does that actually work?
Absolutely. So we deliver it both through health plans as well as health systems. So generally health plans will either have a benefit structure for transportation, or actually their case managers are having nurses spend time saying, oh my gosh, Mr. Doe, Mr. Smith isn't going to be able to make it to his doctor's appointment, and that's the #1 cause of readmission. So they're spending their time calling taxi companies and instead want to use circulation. So that's one way that we deliver. The second way is through health systems. Before, they'd have patients sitting in their lobby not being able to be discharged, or not making it to their follow-up appointment, or not showing up without calling. And so health systems are also putting circulation in to manage that process.
How would that work for an employer? I mean, is there a plan to sort of market to employers? Because quite frankly, not every employer probably could afford that. At the same time, I would argue they should, because they'll save money overall in their spend.
Exactly.
And they'll increase on productivity, so they'll probably weigh their money, if you will. But how might that work? What would be the vision for that?
What's nice about our platform is you can completely configure it to whatever benefit you want to offer, and we can automatically gatekeep around it. So to your point about budget, you can start by saying, okay, I only want to spend this much, and then once I prove that ROI or prove the outcomes for patients, you can ramp that up over time. We can upload employee rosters. For health plans, we do eligibility files. And then link that to a benefit for those employees, for that patient, to say, I want to pay for rides only to PCP appointments, or I want to pay for all rides. Our platform is intended to be configurable so that we can match the secret sauce of whatever proves to have better outcomes in that particular area for that particular employer, for that particular health plan.
How is it growing, and where is it going?
Yeah, we're nearing 100 health systems already.
We actually have 122.
All right,
Sorry.
Well, I wasn't even up to date on the number. And that represents, of course, thousands of facilities across the country. Essentially, we have automatic scale because we're tapping in to on-demand. Lyft is nationwide, so we get automatic scale through that collaboration, as well as the networks of other types of transportation options we provide, because it's not just about the usual Lyft ride. That works for a good portion of patients, but then you need wheelchair car fleets, you need non-emergency ambulance, you need stretcher vehicles. So we're sort of modernizing those fleets, bringing them into an on-demand feel and into our network. And so once we've done that, that kind of scale that we can approach is really, really, really unique.
I think it's really important, like we said before, about fitting into existing workflow and meeting people where they are. We view that the same way for patients. So you don't need an app. A lot of patients that really need our service may be cognitively challenged, senior, et cetera. So they can use an app if they want it, or we can provide them landline phone calls, text messages, or emails, where we let them know at the time of booking, a night before, reminding them that they have a ride, at the time of dispatch with all of the details about who's coming, linked to a live map, a ride survey, because we take patient information really seriously, and also the ability to initiate their own will call ride.
Something just hit me. It's not even about, I almost want to frame it this way. I don't think you're in the transportation business. You're in the mobility business, because this is going to advance well beyond where you are today and what you're doing.
Absolutely. No, we've always seen it as a much broader play than just getting a patient from A to B. Once we start to insert ourselves into the logistics of healthcare, there's all sorts of other issues that come up. So the ability to move employees of health systems around, to, shuttling both patients and employees. There's a whole other component of mobility that starts to emerge. Once you have the platform and the transportation, it becomes much simpler to think about the other use cases.
And to add to John's point, a lot of our clients are actually already doing things like that with us. So some health systems are using this to move their employees. Many are using it to move their home health nurses.
Yeah.
So moving the patients to their appointments and moving nurses to the patients, because that way they can track the entire experience.
And then from my own personal public health background, there's all sorts of opportunities. So think about in a major crisis, say in a pandemic, you want to think about delivery of medicines, of supplies. You want people to shelter in place, not have social mixing. Social distancing is a key. So you can think about we're talking to organizations like the CDC about applying this platform at a national scale in an emergency to serve a large scale.
Well, as we begin to understand that we are living in an ecosystem, and because of that, we are interdependent and interconnected, right? The more we learn that today, the better we will be for tomorrow, because we cannot sustain the conditions that are just destroying our nation. And it's people like you, organizations like yours, that are actually driving and leading that change. So it's an absolute honor. And from health's perspective, we're delighted to have you as future speakers in 2019 and future leaders that are going to be out there sharing this important story. I can only see others saying, yeah, I can think that broadly too. So it is an absolute honor to be with both of you today.
Thank you so much
for having
us. It's
us.
an honor to be with you.
Here's to your future success, which is absolutely coming.
Thank you
Cheers.
so much.
Thank you for having
Cheers.
us.
Cheers.